Claim processing. What is a claim? What does it actually contains? And how a claim process begins. Let's look into this in detail. An incident is inevitable. What is the next step if it happens? Meeting and health service provider for recovery. He meets a doctor for treatment. He then submits his personal and policy details to the health service provider. The health service provider then initiates a request to the insurance company to check the eligibility and benefits of the patient. This transaction is technically called as X12270 Healthcare Eligibility and Benefit Inquiry. The insurance company then responds health service provider with X12271 Healthcare Eligibility and Benefit Response.
This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. In some plans like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Sound easy enough?
Parallelly, doctors work on the case to improve patient's condition. Upon treatment completion, health service provider submits medical bill called as claim to the insurance provider seeking payment. The claim may be in electronic format or in paper format. Electronic claim submission follows the standard ANSI 837. 837 is the format established to meet HIPAA requirements for the electronic submission of healthcare claims. Upon the claim is received in ANSI 837 format, the insurance provider acknowledges health service provider with X12997 claim received transaction. What does a claim contain? Number 1, patient policy details. Number 2, diagnostic codes used to determine diseases, disorders. Number 3, procedural codes which tells the action taken by physician to cure patient's disease or disorder. Number 4, pharmaceutical codes which tells the drugs used. Number 5, topographical codes which indicate specific location in patient's body where exactly the problem is. Claims are then validated and adjudicated at insurance provider end. Eligibility criteria used for claim validation are as follows. Number 1, is the patient eligible for the services that are billed? Number 2, has the claim submitted on time? Number 3, are the diagnosis and procedural codes are properly linked for medical necessity? Claim adjudication is categorized as approved, rejected, denied. If everything is clear in the submitted claim, then the claim will be approved. Once the claim is approved, the claim amount will be paid to the health service provider, and the transaction ends. In some cases, insurance provider may not pay the entire bill amount but health service provider has asked. Instead they pay the allowable amount. Insurance provider calculates the allowable amount considering different factors like co-pay, co-insurance, contractual adjustments. Along with the payment, the health service provider receives electronic remittance advice (ERA) from the insurance company that outlines the entire transactions. Claim will be rejected if the personal information is inaccurate or errors in information provided. Rejected claims need to be researched, corrected and resubmitted. A claim will be denied if the insurance company has found it to be not payable. A denied claim can be appealed for reconsideration. And whatever may be the claim status, insurance provider properly communicates it to the health service provider in the electronic format X12835 standard. And that is all we have about claim process. Have a happy day, goodbye.